My topic is intraoperative topical antibiotics and avoidance of postoperative BCL reduces the risk of post-C3R infection. Keratoconus is a non-inflammatory corneal ectasia, and collagen cross-linking is a treatment of keratoconus, which increases the mechanical rigidity of the cornea and thus delay or even halt the progression of keratoconus. And corneal cross-linking is considered a relatively safe and effective procedure, but there are certain complications reported associated with it, which includes pain, sterile infiltrates, infectious keratitis, persistent epithelial defect, corneal haze or scarring, corneal edema, and endothelial damage. And infectious keratitis is one of the most concerning complications. Scarring and irregular astigmatism may develop even after the infection control and can cause impairment of vision. The aim of our study was to investigate if avoidance of the BCL postoperatively and use of intraoperative topical antibiotics could reduce the risk of post-C3R infectious keratitis. Ours was a retrospective study in patients with keratoconus who underwent C3R at a tertiary eye institute from January 2020 to December 2021. And the patients were included as two groups. Group 1 comprised of those who were treated with postoperative BCL and intraoperative topical antibiotic was not used. And Group 2 comprised of those who were treated with intraoperative topical antibiotics and postoperative BCL was not used. In the Group 1 patients, initially under topical anesthesia, we debrided the central 7 to 9 mm of the corneal epithelium, and thereafter 0.1% riboflavin was instilled every 5 minutes, and UV radiations of 370 nanometer was given at 9 millivolts per centimeter square for 10 minutes while continuing instillation of topical riboflavin, and postoperative BCL was kept, and topical antibiotics and lubricants were given. In the Group 2 patients, under topical anesthesia, initially a central 7 to 9 mm of the corneal epithelium was debrided, and 0.1% riboflavin was instilled every 5 minutes, and along with that, moxifloxacin eye drops was used intraoperatively every 5 minutes, and UV radiations was given at the same for same duration and at same intensity, while continuing instillation of the topical riboflavin and moxifloxacin eye drops. And postoperatively, BCL was not used, and the same topical antibiotics and lubricants as Group 1 was given. And our study group comprised of 129 eyes of 103 patients, which included 53 males and 60 females, and the mean age group was 24. And Group 1, we studied 46 eyes of 37 patients, and in Group 2, 83 eyes of 66 patients. In postoperative period, 3 eyes out of 129 eyes developed post-C3R infectious keratitis, and the incidence was 6.5%. And all the 3 infections occurred in the Group 1, where we used postoperative BCL and intraoperative topical antibiotics was not used. And none of the infections occurred in Group 2, where we used intraoperative topical antibiotics and postoperative BCL was not used. And all the 3 infections were bacterial keratitis with an average day of onset of symptoms of 2, and all the 3 were treated with fortified antibiotics, whereas 2 of them resolved with the topical antibiotics, whereas 1 required penetrating keratoplasty. And statistical analysis was done using Fisher's exact t-test, which showed a p-value of 0.043, which was statistically significant. Coming to the discussion, in the study by Rohit Shetty et al., who used standard protocol with the use of postoperative BCL, he reported 4 eyes out of 2,350 eyes developed bacterial keratitis post C3R. And another study by Okay et al., who also used standard protocol with postoperative BCL, he reported a case of post C3R MRSA keratitis. In Samora and Mills reported that patients with polymicrobial keratitis after C3R had history of handling BCL in the immediate postoperative period, and postlated this could be a risk factor for post C3R infectious keratitis. And Samalis et al. Also found that the use of the BCL and topical steroids prior to the healing of the epithelium is a significant risk factor for microbial keratitis. And in our study, in Group 1, where we used postoperative BCL and did not use intraoperative antibiotics, 3 eyes of 46 developed post-C3R infectious keratitis. Whereas in Group 2, where we used intraoperative topical antibiotics and avoided postoperative BCL, none of the cases developed post-C3R infection. Thus, we concluded that The use of intraoperative topical antibiotics and avoidance of post-operative BCL could significantly reduce the risk of infectious keratitis after collagen cross-linking. These are my references. Thank you.
Very nice study. I have a couple of questions for you. The first question was, how long did you follow these patients? What was your follow-up schedule for these patients?
We follow
Both the groups.
We follow up the patients in the next day, then first week, and thereafter 1 month, and then for 6 months we follow up the patients.
The second question I had was, there was too much of a difference between group 1 and group 2, meaning it was group 2 was almost double.
Yes.
So how do you account for that?
Initially, after a couple of cases of infections occurred, our consultants thought of changing the protocol, and I took the time period 1 year before changing the protocol and 1 year after changing the protocol.
The third question is that, how do you prove that your the group 2 is much better than group 1 then? How did you prove that? Because that is your conclusion.
Yes, sir.
So how do you conclude
Because in the group 2, when we changed the protocol, there was none of the infections. Whereas in the group 1, there was 3 infections in the post cases.
there's so much of a discrepancy, right? The number of patients that you have recruited.
Yeah, but the time period was same, sir. 1 year time period was used. That
What is
is.
the normal short period for the osteoporosis and eyebrows? Because you said you followed up first day, the next day, and then 1 week later.
Yes.
So did you measure the epithelial defect, how it healed and all that?
We checked the epithelial defect. Yes, sir. We looked the cornea, how the epithelium was healing, and most of the patients tolerated it even without the BCL in the group 2.
Why do you want to have it as either or? Why can't you have BCL with antibiotic?
Yeah, that's a drawback of our study. We didn't study each one separatively.
They're given for different reasons. No? BCL
Yeah.
is given to prevent the
In most of the studies references, BCL was found as a culprit for the post-operative infections. Therefore,
the absence of antibiotic.
yeah, yes, sir.
I'm saying. So
Yeah.
they are given for two different reasons. You have two totally different ones. You don't have one in between where both could be.
Yeah, we didn't try that, so
Is
we are
there a
looking.
problem of giving oxyfloxacin with the BCL in place?
No, sir.